Hello, everybody. This is Dr. Downs. I'm going to talk to you about the Sleep Balance Academy SDR program and administered by myself and Shane Smith. I'm going to just go ahead and review the welcome letter first. So let me go and show you my screen, and then we can get you oriented. So let me just do that first. All right. So this is the letter that you're all sent. It contains the instructions on what's the first steps that we need to do in the SDR program. And you can see here that I've written some things about you're getting the nasal aids. Not all of you have gotten all these things yet, okay? I understand that there are things that are like delayed. I'm only being allotted like 20 of these night owls per month right now because of supply chain issues. But we have the night owls, and I've been sending them out, and some people are using the sleep image ring instead, which is fine. And so the night owls are our FDA-approved sleep studies, and so is the sleep image ring. Now, the circle ring is not an FDA-approved sleep study, but this is the thing that you'll use over and over again, and this is what you'll sell to your patients on your initial encounter with them with the sleep program. And I've issued you a letter that you can use as a welcome letter to patients. I'll show that to you in a moment. You can modify it any way you wish to and be able to use that as a introduction to why you're getting into sleep medicine, so they'll understand why you're doing it. Many of you have already onboarded with In-Hand Health. It's also called In-Hand Dental. And there's two apps that you get from the App Store. One is white and one is blue. And the white one will allow you to monitor your patients. And the blue one is you're going to be a patient of Shane and I's, so that we can monitor what you're doing with our program and make sure that we're supporting you and monitoring how many things you're getting done on the things that we've recommended you do. This is the way we support you in your coaching relationship with us. That particular membership in that program is very good. I was on the phone with Brandon Brown the other day when he was oriented on the program, and he seemed really excited. He took to it like a duck to water, so it was really grateful to see, and he could see now how invaluable it's going to be to his practice because it has so many uses besides the sleep program that we're going to be doing. So you'll also be enrolled in the Sleep Balance Academy membership education program. So some of you have done this and some of you have not, but in here there's your enrollment link right there. Okay, I want you to click on that enrollment link or copy and paste it to your browser and go ahead and register for the training program. It's an abbreviated program that's not very long. I've shortened it because we're not going into the treatment and understanding of treatment modalities in this program. This program is just centered around a screening, diagnosis by a physician, and referral. And with that, I was talking to Shane today, and it's working for him. He's enrolling people on the program for about $1,000, and each patient that comes in on that program with the ring and the monitoring that he'll put them into, he's making anywhere from $500 to $700 on that advertisement and bringing the patient in. And then, of course, many of these patients need chiropractic care as well. So it looks like a very win-win situation. So do that. Now, if you get billed on the first enrollment in the Sleep Balance Academy program, just remember for the first 3 months, those monthly billings of around $45, I'll write them off because you've already agreed. I've already agreed to that. There's three months of free enrollment in Sleep Balance Academy, and also the same thing is true with the In-Hand Health program. We've already paid your onboarding fee and 3 months of membership there. By the time the 3 months is over with, this should be more than paying for itself. All right. On the fifth item here, you'll see a link to a slide deck that you can use for community Gang of Five presentations and community presentations. I've also uploaded video onto my Facebook site that you can look at to see how I present that slide deck, and then you'll understand how it's used, and then you can modify it the way you want to. Okay, on item, let's go ahead. We've already talked about the In-Hand Health. Now 7, you'll receive some nasal rinses. These nasal rinses are going to be something that you're going to be wanting to use very frequently with all your patients, even those who don't have sleep apnea diseases. People need to clean their noses. It's extremely important, and you'll understand why as we move along in this program. But nasal breathing is extremely healthy for you. We want to get people away from mouth breathing. Nasal breathing brings nitric oxide into your lungs, dilates the blood vessels, lowers blood pressure, is good for your heart, and gives you approximately 10 to 15% better oxygenation in exchange in your lungs. Nasal breathing is extremely important. Filters out allergens and microbes. So that'll be an ongoing sales item for you, but it's not quite done yet. I'm developing 2 rinses. It'll be a dual rinse. One is a nasal xylitol rinse, and the other one is a hypochlorous acid. Both of these rinses are completely natural products, but they are superb cleaners of the nose and an anti-inflammatory of the nose. On item number 8, you'll see the access to the SBA forms. So you'll go to that link there, and you'll see the forms that we're going to be using. I'm going to show you some in just a moment. Please do look at the Better Sleep screening forms, and I'm going to show you those in just a second. You're going to have this orientation again on Monday night. Hopefully you will show up for that. And if you're not, we'll have this recorded, but it's going to be important that you start participating in these live presentations. Okay, so let me get rid of that for now. And let's go back to this site here. On the Facebook site, you'll notice there are 2 sites. One is the Dental Chiropractic Sleep Apnea Collaborative. This has been around a long time. We have over 276 members. Many hygienists, dentists, and chiropractors, and nurses are in this site, and dental assistants as well. We have this site for general purposes, for helping people understand and get some value from what we learn and know from Dr. Joe and I and from Shane. If you're in a paid program like ours that we're just now putting together with you guys, then you're going into the Sleep Balance Academy private site. And you can see there's only 17 members in here. And this is going to be fairly exclusive for you guys. In here, I want you to go, first thing I want you to do is on this orientation link here for YouTube, you can watch this, and then it'll help you understand how to use this site. I want to show you some media that I want you to look at. Let's start with the files. So I just showed you this letter, this introduction to the welcome letter. I just went over that down here. Now the Better Sleep form. This is the screening tool. I want you to see this. Let's open it up. And you'll notice that these will download to your computer automatically, which is great because I want you to have them on your computer. In here, I want you to print out about 500 of these forms, okay? And this form, fill out the patient's name and demographic here. And then you'll have some sections down here. If they answer yes to these questions, you need to ask them how long or how many years they've been doing. Answer yes to these questions. Do you snore at night? And then there's a yes or a no, and they have scored, like there's a 2 there and a 2 there. If your snoring is loud, another 2. Okay. If you experience questions, the questions below, how long are these again going on? And you go ahead and put that up there. Has it ever been reported to you that you stop breathing or gasp while sleeping? And you say frequently, occasionally, or never, and you put the score here. Okay. On the section 3, what is your collar size or neck size? For males, anything over 16, or anything greater than 16 and a half is given a score of 5. Anything under that is given a score of 0. And a female, anything 15 or less is a 0. Anything larger than a 15 is a 5. That score goes here. And then how long have you had this again? Do you occasionally fall asleep during the day? And then that says when you're busy or active, yes or no. When you're driving or stopped at a stoplight, yes or no. But the score is here. And then again, they ask you how many years. Then you total up your scores, and anything that has a 9 points or more is a high risk for a sleep study. In other words, that tells the patient and you that they need a sleep study. 6 to 8 points is a moderate risk for sleep disorder and may require a sleep study. And then 5 points or less probably is low risk, probably the low risk of the need of a sleep study, but it doesn't mean that you can't order a sleep study depending on the next section. And the next section is the Epworth sleepiness scale. And in that particular situation, you ask people how sleepy they are in these situations, rank from 0 to 3, sitting and reading, watching TV. And by the way, this is a non-caffeinated person, and they haven't been drinking coffee. You must ask them that. And then watching TV, sitting and talking with someone, sitting quietly for lunch quietly after lunch without alcohol, sitting inactive in a public place, as a passenger in a car for an hour without a break, lying down to rest in the afternoon when circumstances permit, and in a car while stopped for a few minutes at a traffic light. So these are answered in 1, 2, 3. And again, these Epworth score, if they score 11 or more, that's a pretty significant issue. 11 or more means that they are highly sleepy. Now, not everybody with sleep apnea is sleepy. So the only reason you want to have this is, well, not the only reason, but one of the reasons you want to have this because insurance companies like it. And so if you're going to be dealing with insurance, they want this score. And the other reason is that because it's just another reason to give you some indication whether they need a sleep study or not, the FDA approved. So this should be done on all patients that come in on the marketing program, and everybody who comes in for a recare or regular patients who are coming back for care. So this is something that you should implement. I print 500 of these, and go ahead and start having them fill them out. You can have an office assistant do that if you want to. Okay, let's get that out of the way. Let's go back to Facebook here. Now I'm going to show you the next. Here we go. Refresh my page here. There we go. Okay. In here in the area where the files are some more forms that I want you to look at. And this is the form we just showed you, the screening form. But then there's a sleep screening order form. Now, the Sleep Center Sleep Study Order Form is something that you only need to fill out if you're ordering a sleep study from a telemedicine. And that form looks like this. So let's say you've done the screening form and you think the patient needs a sleep study and they want it covered by insurance like Medicare. Medicare requires that a physician sign off on getting the study if they're going to pay for it. Now, I'm not too concerned about that. If you have a night owl or a sleep image ring and it costs you anywhere from $16 to $20 for a test, and you do one night and it looks pretty bad, you can use that as a reason for ordering a sleep study from the physician. I mean, just record another night. It's no big deal. You can record another night and not bill the patient again if you want to. It's pretty simple. But if you're going to also for dentists, 7 states that don't allow dentists to order sleep studies, patients can order their own, by the way, without anybody's approval. So it's kind of silly, but this is the form you fill out if you want to get a telemedicine call for your patient with the sleep specialist. And also, they will then order the sleep study. So you fill out the form on the bottom here up. Okay. So these first 2 sections here are what you fill out. Okay. And you've got, just check off, what they have. They have narcolepsy, or they have excessive daytime sleepiness. They have obstructive sleep apnea or witness pause or breathing at night. And the ICD codes are right here. Okay. That's kind of nice. Down here, you can report more of the for the diagnostic purposes that they're snoring loud. They have daytime, tiredness. They have ischemic heart disease. They've reported to you that they have that. They have asthma. They have problems with cognition, the fatigue or malaise, hypertension, stroke, COPD, obesity, morbidity, shift work disorders, mood disorders, and all kinds of things are listed here that support the fact that you need a sleep study. Then below here, from this point down, you don't fill anything out. The person doing the telemedicine call, either Dr. Ali or Dr. Zelk, will check off what they want you to do, what kind of sleep study, and they'll probably do whatever you have in your office. So I wouldn't be too concerned about that. She's not going to suggest a polysomnogram, but if she does, that's an in-office sleep study done in a sleep clinic. You won't do that. You'll just send them to the sleep clinic. Okay. If that's what they recommend, then you just send them off. You're probably not going to issue a titration study for a CPAP. So that would be done in a clinic. Okay. The split night study, she's not going to recommend unless she thinks the patient's too severe to be done with the home sleep study that you have. If so, you send them off to the sleep center. And then she'll put down whether she wants a 1 night or 2 night and that sort of thing. On the other hand, if she wants to get a home sleep study done and you have home sleep study equipment, then she'll check off these down here. And these will qualify. You'll have devices that can do these things. She can fill out the height and the weight of the patient and things of that nature. And she'll make her order down here. And then she knows that this is complying with Medicare requirements right here. Okay. So that form allows the patient to order a telemedicine and for you to administer a sleep study. Okay. Now, if the patient is authorized to do a sleep study, or you do a sleep study and it's abnormal, and you want to order a sleep study, then you go to the Sleep Balance Academy site and order that on our site. And let me show you that. Again, I have to go back to the, I'm probably not doing this right, but I'm going to go back to the Facebook site again. And we'll go back to Sleep Balance Academy, and I'll show you where you can do that. Just scroll down here, and this is where you order your sleep studies and your supplies. Okay, it's Gallery 3, Sleep Balance Academy. This site I specifically made for you, and it clicks on that, and you go right here. It's a special orders site for the chiropractors of the SDR program. Scroll down, you'll see a little thing by me about why you need a circle ring and a night owl. And you can order more night owls here, more circle rings here, a single night owl here, a single circle ring here, a sleep image ring here, or just if you don't want to order the sleep image ring subscription and you just want to order one from Shane, that you want to order one night of sleep study on the ring that you gave your patient, you just send the email and the name to Shane, and he will put it in his portal, and the patient will get a notice and be able to do their sleep study on the sleep image ring right from his portal. You just have to pay for it here. Nasal aids, the nasal dilators you can buy here, and then the telemedicine sleep study is right here. So if you're ordering a telemedicine sleep study from the MD, just click on this. Takes you right to the order page. Add it to your cart. Then you'll be able to put in the patient's name, and you'll put in here, you're not the Air Institute, you're the Chiropractic Collaborative member. So click on that. And if you know which doctor you want to do the sleep study, that's fine. Joseph Selk is presently in 2 states. Dr. Ali is in all the others right now. By the way, when you order these, it can be a long wait before they get the telemedicine call because these people are busy, but it's still shorter time than it takes for these patients generally to go to the local physician. And these doctors, these 2 doctors, know what you're doing. The doctors in your town may not know yet. I want you to build up a relationship with them. But for now, especially if you're treating, they won't even know what a 9-app is. These are the doctors. They won't know what a Excito SA or a Bongo RX is. All they know is CPAP, and most of the patients don't like it. So order one of those. If you don't know, just put I don't know. Okay. And then the state where the person needing the sleep study resides, and their demographic information, their height and weight, their email. And then you'll get a Epworth study again. See that? There it goes, just kind of in a vertical form. And then the same questions on the snoring. Okay. And then you'll put the scores down here. Some privacy policy information, HIPAA. And then you sign it here with a printed name. Add it to your cart, and you're off. Okay. And then I'll get that, and we'll get the telemedicine ordered for your patient to get a prescription. By the way, once the prescription comes back, let's say Dr. Ali or Dr. Zelk gets you a prescription, they might recommend a CPAP. If they do, just send them off to the CPAP store and let them go ahead and get it done. If they send you back a prescription for an INAP or Excito SA or for an oral sleep appliance, if you can do that, do it. But if the oral sleep appliance, then refer them to the dentist. One that you will want to work with, call me, and I will begin to enroll them to work with you. You'll become their best friend if you send them a patient already diagnosed, already has a prescription for an oral sleep appliance, and they walk into the office with the paperwork all done by you, uh, they're going to go, this is amazing. They've never seen it before. They will be absolutely astounded. Um, you can begin to tell them then that the first person that patient needs to see once they put that oral appliance in the patient's mouth is back to you. So you can manage their TMJ soreness and help them get adjusted to this new appliance that's stretching the muscles and joints in their head. Okay. So uh, just make that arrangement with them. I think they're going to be more than happy to comply. And I believe you're going to get more patient referrals from the dentist for that, and even from physicians as we develop that. So fill that out. And as you can see, the purchase price for that telemedicine call is $199. Now that should be built in to your cost of your circle ring and your initial invitation for the patient to come in. Now, if you do a screening with your circle ring and the paper form, and neither one of them show much indication that the patient needs any treatment or even a sleep study, then you don't have to order this. So the circle ring is going to cost you somewhere in the neighborhood of $240, $245. The nasal aid, probably somewhere around 20, a little less than 20. And even the nasal rinses, probably somewhere around 10. So um, uh, you're not going to have a lot of money into this that you're giving the patient. Your profit will be somewhere around $500 if you have to do a telemedicine call. But if they don't need a telemedicine call, you just keep this. Okay. If they don't need to go any further, their tests and their screenings all look normal, then you put them on the monitoring program, the In-Hand Health, at $7 a month or $10 a month, whatever you decide, and begin the monitoring program to see how they're doing with their sleep and monitoring their respiratory sympathetic mode via the circle ring. And they will be reporting their circle ring results to you through the portal of In-Hand Health. I'd recommend maybe once a week to start out, and then maybe once a month after that. Okay, because you don't want to be looking at hundreds and hundreds of your patients' circle ring results every day. That's just going to be too much. Monitor them maybe once a week for a while, and then once a month from that point on, or once every 2 weeks. It doesn't matter. That In-Hand Health portal is going to keep them in contact with you. It's going to be extremely valuable in your reactivation, your marketing, and many other things. You'll see why it's so valuable once you do your online orientation and onboarding with In-Hand Health. All right, so let's go back here. Once again to our Facebook site. I'm not going to spend much more time with this today, but essentially, I want to see what's in there. Now, I'm not going to go through all these files, but I'm going to show you what's there. So in the files area, you'll see the request to be coach. Some of you have sent me your request, have signed your request to be coach and sent it to me. Either Shane or I needs to countersign that for you. Both Shane and I don't have to. I was doing that at first, but now either one of us can sign that and it'll be done. This is the welcome message that we. Oh, and then there's a Chiro introduction letter to patients that you should look at and modify for yourself. And then this particular PDF is kind of confusing. Don't worry about it. In the media area, I'm going to be adding a few more videos in here for you to look at. just some orientation. But here's where I explain the use of those two forms that I just explained to you. And there'll be some other videos here on how to use the night owl. You'll see Dr. Zelk doing a laser procedure to shrink the palate and the tongue on a patient. Eventually, we can train chiropractors to do this. And so that will be for a future event. Okay, let's go to the discussion area. I'm going to move down. Again, this particular video, I want you to watch it. I'm going to show it to you real quick here. Yeah, that is not what I'm looking for. Probably just a advertisement. I'll make sure that we follow up on that one. Yeah. Okay. This is the video on how to do a seminar on the women's and children's community seminar. And that would be good to watch so that you can know how to do your own Gang of Five or community seminar with this slide deck that I'm sent all of you to. And there's some welcome notes here. Here's your Gallery 5 ordering area. Remember that, Gallery 3, I mean. There's your intro to medicine for the patients. Bed of sleep form. Request to be coached, which we just showed you. And then this will talk a little bit about the Portland protocol. If you want to be interested in what the dentists are doing. Here's the screening forms that I told you about, how to use them. Looks like there's two of those. Portland protocol. This is kind of a cute little thing about bones. This is our malfunctioning therapist. Shirley Gutkowski, I want you to see this seminar, this little instruction video. It's very short on how to clear the nose, myofunctional therapy for clearing the nose. And this would be valuable for you to share with your patients who are going through your sleep protocol. This is on how to set up the Z machine. If you ever want to get a Z machine, there are pilots who only are allowed to get a Z machine home sleep study. We can order those for you. I had order one the other day from Florida, yesterday actually. Airline pilots cannot use the ones that you have, the Night Owl or the Sleep Image. This Z machine is something we can order for them for you through our site. So I want you to know that Z machine is for pilots. Okay. There's the sleep image orientation. So you could look at this. I think the sleep image orientation is important for you, those of you who are using sleep images in your work. And then I will go over the Night Owl with you probably on Monday night. This is the head and neck exam that I do. This is the person who is the COO of Circle Plus, and we have an interview with him. Another INAP setup. That INAP setup is not necessary to watch unless you're going to be treating. But if you want to see something, that's fun. Special pricing for SBA members is on this site. Now this site here, just snap it with your phone. It may take you to not only the chiropractic special pricing, but dental special pricing. There'll be some treatment products in this site. And this will talk about the circle ring and how to use it. And then this one shows me putting in a oral sleep appliance on Sean last year. And you might find that curious because um, you'll know what dentists do and how they help patients with their sleep. This is Dr. Zuck doing the night lace again. This is the Excite OSA that you may want to learn about later if you want to do treatment. This is a tongue stimulator machine that you can loan out or sell to patients. And here's all your forms and files. So go here for all your forms and files. There are more of them than I have up here. There's quite a few files in here that I think you'll find useful. This is about the Excite. And just a kind of initial orientation to Sleep Balance Academy, our education area. And another INAP orientation. Here's where you can see some information on Sarasota last year. Too bad they're probably underwater this year. I'm so sorry about that. All right, that's enough for tonight. I'm sure after you watch this, you'll have questions for me Monday night. So be on the call Monday night. Thank you very much.